I'm Sanchez-Romero, and I'm a research instructor at the Cancer Prevention and Control Program at Georgetown University Lombardi Comprehensive Cancer Center. My main interest is in the use of population simulation models to develop and assess tobacco control policies. Briefly, simulation models is a tool that synthesizes the best available data and tries to simulate as close as possible to the reality the development and progression of a disease. It allows, by using existing data and mathematical equations, to estimate in a shorter time long-term outcomes that would otherwise, by using randomized control trial or cohort studies, could take years and be much more expensive. So in particular in my research, what I do is I collect data of smoking prevalence, smoking associated diseases, and I combine those with national birth rates, mortality rates, population projections, as well as the effect of a potential or implemented tobacco control policies. So then I use this data to estimate what would be the potential effect in smoking prevalence or smoking associated deaths of implementing a tobacco regulatory policy. Meaning that the purpose of it is give the policymakers information about if the planned policy could be actually effective or modifications has to be made. Modifications regarding, for example, should we make the tax bigger? Should we encourage enforcement of the policy? So I started in this field mainly because my interest in population simulation modeling. It may sound weird that I have that specific interest because the population simulation modeling field, particularly the one that targets development of preventive policies for chronic disease prevention or control of risk factors, it's very small. So what happened was that before my PhD, I was working at the National Institute of Public Health in Mexico. And during that time, I had the chance to directly work in the adaptation of two population simulation models that their aim was to assess what would be the effective of implementing in Mexico obesity prevention policies. While I was doing that work, I felt passion for simulation modeling that I haven't had for other topic. I really love it, and I knew I wanted to know more and become an expert in this field. So for my PhD, I pursue more knowledge in this area and target my PhD project in developing a macrosimulation model to project obesity trends in Mexico. After finishing my PhD, I had the chance to work on some modeling projects with Dr. Tonatiuh Barrientos at the National Institute of Public Health. And it was through him and his research collaborations with Dr. Rafael Mesa and Dr. David Levy from the CAsToR group where I got the chance to work closely with them and get more involved in the tobacco regulatory field. Working closely with these experts in tobacco regulatory research gave me the chance to witness all the efforts researchers, federal agencies, and other stakeholders put into develop and support the implementation of tobacco regulations. This was a life-changing experience for me. They made me feel passionate about the area, and I felt this is what I wanted to do. I wanted to put all my efforts and contribute with my research using population simulation modeling to provide evidence to inform policy. And that is why and how I'm now in the area of tobacco regulation. Tobacco regulatory research, but in particular modeling, is an effort of a multidisciplinary group. Modeling groups usually have an economist, a mathematician, a programmer, social scientist, experts in health policy, experts in public health, and experts in epidemiology. And each one of us contribute with a very important part of the model to obtain our outcomes. So my recommendation is that even if you feel either your academic background or your previous work experience may have nothing to do now with the field of tobacco regulatory science, but you want to pursue a career in this area, you can just take a leap, ask, look around, look at opportunities in resources such as the Tobacco Regulatory Science Knowledge Center, which has a lot of information of opportunities and contact with tobacco researchers. I'm sure that you will find in the field, because it's very, very big, someone that shares your same interest in the tobacco regulatory area, and they will be happy to help you navigate through this field.